In 2016, Durham and his colleagues developed a medication safety program aimed at reducing medication error through improving RN behavior and awareness of potential error risk. They identified that challenges associated with avoiding medication errors include time pressure, poor human system interface, information overload, misperception of risk, and lack of system feedback. Additionally, many nurses work in fast paced environments that are full of distractions, and multitasking is often normalized. Their safety program was developed using 4 evidence-based strategies for decreasing medication errors. System improvements that aid the nurse in verifying the 5 rights of medication administration, error-reducing behaviors like checklists and simulation-based training, mindfulness when faced with mishaps, interruptions, and distractions, and error interception like knowing the patient, knowing policies and procedures, checking medication against the record, verifying patient identification, and minimizing interruptions. These strategies were organized into a 3-hour instructor-led presentation attended by 79% of the hospital's ICU staff and 75% of the acute staff. 10 weeks later, they noticed a 61% improvement in day 1 medication errors, which is when most errors occur at their facility, and a 72% improvement in day 2 to 4 medication errors. Additionally, the use of error interception practices increased by 92% in the acute unit and 303% in the ICU. Human error is inevitable in complex environments, so behaviors in the system need to be managed to promote safety. In 2019, Martin and his colleagues conducted a study to explore the experiences that nurses have with applying the RIGHTS framework, which is a globally accepted tool used for preventing medication errors. They observed 20 nurses as they administered medications and attempted to follow the RIGHTS framework throughout their shifts. As expected, many of the nurses encountered obstacles and were forced to go beyond the framework in order to ensure medication safety. In spite of the RIGHTS framework being widely utilized, medication errors still occur because organizational factors such as workload, staffing, supplies, and interruptions can interfere with nursing workflow, leading to difficulty in complying with the 5 rights framework. For example, applying the principle of right patient can be complicated by a patient having decreased level of consciousness, right medication can be complicated by prescription errors, and right time can be complicated by unavoidable delays. Although the RIGHTS framework was useful for preventing medication errors, it was not fail-safe. According to Martin and his colleagues, medication administration was not a linear process or routine in nature, as there are numerous influences, interruptions, and challenges that impacted on the participants' practice that cannot be addressed by the RIGHTS framework alone. The 5 rights must be supplemented with clinical reasoning and situational awareness to ensure effective and safe medication administration.
Improving medication administration. Small efforts make a big difference. A continuous quality improvement study published in 2017 examined the efforts of healthcare organizations to reduce or eliminate interruptions during medication administration. The author notes that some hospitals have adopted no interruption zone areas to prevent distractions while preparing medications. The author also notes that other healthcare organizations have introduced the use of medication safety vests for nurses to wear to alert colleagues and patients of their involvement with medication administration. Other healthcare organizations have adopted signage on the nursing unit and within patient rooms. Do not disturb the nurse during medication administration. By the end of the 3-month continuous quality improvement project, where these safety measures were practiced, an 88% decrease in medication error rates occurred after implementation of the medication safety vest. 4 weeks after this continuous quality improvement study concluded, only 1 medication error was documented, and it occurred when the nurse was not using the safety vest.
To help us remember medication safety, let's remember the mnemonic, give meds. So G is for be a good nurse and pay attention. And then we're going to use I in interruptions, so no interruptions while you're giving medications. We're going to use the V to remember V in love to label. So you're going to label all your medications with the correct information. When we have E for extra care with blood thinners. And then we'll use the M in communicate so that you communicate the information that you need to give to the patient. And E, in the checklist, we're going to use an E. So make sure you have checklists so that you can be sure you're using all the correct steps. The D will be in the word record, so record your data after you give the medication. And then S in mindfulness. So make sure you have mindfulness when you are paying attention when you're giving medication so that you can give your medication safely. Okay, so this wraps up this review over medication safety. Thank you so much for watching. And don't forget, we have a Kahoot, a free quiz at the end. Please go to kahoot.it on your phone and wait for Ms. Walls to share her screen and we can all play the game.